Hi, Claire. How are you?
I'm good, I guess. I've just, I've had better days.
Okay. Do you want to talk more about that or?
Sure. I know like last time we met, we kind of got into it a little bit, so I'll try not to too much
Hmm.
today, but I'm just like super stressed and my husband's always like away, and so like that leaves me with like four children, and like
Mm,
although like I have like help from like the nanny and stuff, like it just never seems to end,
sure.
and so like I have to like maintain the household, and like I'll like get up and think like, I'll have like some me time while they're away at school. It just seems to go by so fast, and I'm just like super stressed. And so I went to like my doctor's because I was like so anxious,
Hmm.
and just like so stressed out, and she prescribed me Xanax.
Okay.
um and so like I'm taking, so it's like a 1 milligram dose.
Okay.
I don't really know in terms of where I stand on how much that is, but it seems like what I've spoken to with my friends that it's like a pretty high dose,
Hmm.
but like I don't feel that way. I mean, like she it's been going on for some time because like with my husband's like new job, like he's always traveling, so like for like the last 3 months or so, I've been on Xanax to kind of help, but like I don't want to like tell him that I'm like taking it because then he's gonna feel bad about having to work, and I like understand that he needs to do it for our family, but
Sure.
yeah, so that's kind of where I'm at right now.
Okay.
um
So correct me if I'm wrong, but what I'm hearing is that you're feeling like really overwhelmed with kind of the daily duties of being a mom. And
yeah.
although you have some support from your nanny, you just feel like it's just, at times it's really like too much for you.
Yeah,
And
I feel like I just can't breathe. um
mm,
it just, I don't know, and then it like is super sad. And I just like I feel like I'm like depressed, like I just like don't have the energy to like do anything, and like I
mm,
just like find myself sleeping on the couch, and like sleeping all day when I'm like they'll go off to school.
mm,
The nanny will usually like arrive when they're like um back from school, so like I have that kind of coverage.
mm,
But then I like find myself sleeping all day when I wanted to do all these other things. And then um yeah, and then when I want to spend time with them when they get home,
sure.
but I'm just like too tired, so I'll like sneak away and like
Yeah.
tell them I'm gonna go do yoga or something, and then I just like go and take a nap. So and then like the nanny will come and just like knock on the door, and she thinks I'm in there being productive, but I'm really not.
Mm,
uh,
okay.
so I don't know.
Okay. And so before you mentioned that you were working with your doctor, your primary care, who had prescribed you the Xanax. And
Yes.
I'm curious, did you start off at a lower dose, or did he or she start you at the 1 milligram?
No, I think we like titrated up because like after a month I started to like feel like it wasn't really doing anything for me.
Okay.
uh, I was still kind of feeling panicky, and they told me it would kind of help with those feelings of anxiety.
Okay.
um, but like I don't really take it every day. Some days I take, um because they told me to take it like once every 8 hours.
Mm-hmm.
I just like don't feel like it's working, or that like I'm so anxious that I'll just like pop an extra one.
Okay.
But um but then I'm like super tired. So and then I just like feel like really anxious, and like my heart is like going really fast, and like my hands are sweaty.
Mm.
So it's like helping me to relax, but then my
Mm-hmm.
body's like freaking out.
Yeah.
So I don't know if I should like get off of it, or um I don't know. I don't want to get off of it because I need that kind of additional
Mm.
help. Um,
So
so
I hear you that you want to stop it, but you're not sure. But one thing I just want to touch upon really quick is that I wouldn't recommend just stopping it abruptly, because there can be some, if you've been taking it for the past few months, there's some, risks that associate with detoxing from it. So I'd want you to be working with your provider on tapering down safely before you decide to stop.
okay.
But I also wanted to touch upon something else that you had just also said, where you had mentioned that you went up on the dose. I'm curious, did you work with your doctor on going up on the dose, or did you just feel like your anxiety was so heightened that you just took more to help those symptoms?
Yeah, I hadn't really gotten a chance to like talk about it with my with my my PCP about it.
Okay.
Um, but like, my friends they told me like, yeah, it's fine, just like take another one. So I was like, okay, cool, I'll just take another one. Um, I'm like, I don't really see anything super serious. It really does help me to like not feel anxious, but then there are times where I'm just like so anxious
Yeah.
that I don't know, it just like makes me feel like I have like brain fog or something. Like I just like
Yeah.
just forgetting things, and I don't like that I start to feel like I'm like I feel stupid.
Oh, well, I'm sorry that you're feeling those ways. Would it be okay if we kind of touched upon, like, or if I gave you some like information about Xanax?
Sure, yeah.
Okay. I don't know if your doctor has talked to you about like like how it's supposed to work or whatnot. So did he discuss any of that with you?
Sort of, but it's like, like they're busy and it's like a
Mm,
15 appointment, and
yeah,
like they're trying to rush out the door. So I'm just like nodding my head so I can get out of there.
sure. And that's something common that we see, that the patients feel rushed or they feel like that they're not doing a good enough job explaining things. But if it would be okay, I'd like to give you some information about Xanax. That would be okay.
Yeah, that'd
So
be
Xanax is in a class of medication called benzodiazepines. And the purpose of Xanax is it's supposed to help people that have anxiety symptoms, such as like a panic disorder. And it's kind of a short, it's supposed to be used on a short term basis as opposed to long term, just because of the risks that are associated with it. So there are some risks of dependence or overuse or abuse. Um, so I want to be mindful of that. Um, and did your doctor give a specific timeline that you had planned on being on it for?
she said that typically it's like 3 months or so,
Mm-hmm.
up to like 6 months, depending on how I felt. But since we kind of like titrated up,
Mm-hmm.
um, I don't know, we haven't had that discussion yet.
Okay. All
Do you
right.
think good?
I definitely think you should have that discussion, because you said you've been on it for a few months so far, right?
Yeah.
How many months have you been on it?
Um, about three.
About
About
three.
three,
Okay.
5. Yeah.
Okay. Um, and I'm curious, have you ever, like you mentioned that you just feel like so anxious and that it's like unbearable? I'm curious, have you ever sat with that like feeling of like such unbearable anxiety, and have you ever just sat with it and not taken anything for it?
Well, like in yoga, they tell you, like let's practice mindfulness and
Mm-hmm.
whatnot. Like, I see the value of that, but like I feel really lonely right now with like my husband being away and having all these children around me who I love, but
Mm-hmm.
it's like sometimes the stress outweighs the love. So it's like I'm in this like place where I feel like I'm forgetting who I am.
Mm-hmm.
Like in those moments, I'm just like, ooh, I'm just gonna pop a Xanny because I'm like, no, I just, this is too much. I can't deal with anything more than this.
Okay. All right. And have you talked to your husband about those feelings of loneliness that you're having?
No, because like I don't want to like stress him out. Like I said a little bit ago, he works a lot, so it's like when he's home, we try to do more like family stuff. Like I want to be someone positive in his life.
Mm-hmm.
But it's been hard to kind of keep to myself because I feel like I'm drowning.
Sure. I think that's a lot to, keep into yourself, especially when you have 4 children, you have a husband, all of which whom you seem to love and adore. So, it's a natural instinct, I think, to want to protect those that we love, instead of, taking care of ourselves. So I'm curious,
Mhm.
would you be open to talking to your husband about how you're feeling?
Yeah. I feel like a little bit of help on how to kind of word that with him. 'Cause I don't want to like scare him and
Sure.
like he's like very protective of us. It's like I don't want him
Mm-hmm.
to feel like he needs to like go quit his job because I'm like in a crisis or something.
Yeah. Well, that's very kind and selfless of you to not want to do that and to protect him.
Yeah, yeah, I don't know. I love him. I feel like I need to like figure out how to take my medication better or like find better ways to like deal with stress.
Mm-hmm.
So I'm kind of hoping that we can kind of work on that together because like I don't want to be on medication for the rest of my life.
Okay.
Um, but I feel like I'm like heading down a path where it's like it's starting to kind of negatively affect me.
Yeah.
It's just like I don't want my kids to see me that way.
Yeah, absolutely. So have you looked at your Adderall bottle to see what your Xanax prescription, sorry, to see how it's actually written out to take it as prescribed?
No, I haven't.
Okay.
I probably should now that you mention it.
Yeah, that'd be a good thing to kind of have in mind, just to see um, how it's supposed to be taken, whether it's like once a day as needed, or if it is every so many hours, as you had said. I think that would be good.
Okay.
Would it be helpful if kind of collaboratively, like me, yourself, and your primary care worked together to create like a better plan for how to properly take your medication? Would that be helpful for you?
Yeah, that would. I'm just like a little scared of like getting in trouble. Like, do you think that I'm gonna get in trouble?
Okay, in trouble in terms of what?
Because I'm not like taking it as I'm like supposed to. Do you think that they'll like stop me? Like they'll stop prescribing it to me?
So I just want to pause there for a second because correct me if I'm wrong, but earlier you had said you talked to your PCB about taking it every 8 hours, right?
Mm,
Okay.
yeah.
So did he prescribe about 3 a day, or?
Um, Give or take, yeah, but he doesn't know that I'm like taking it. Sometimes I take more than I need to.
Okay. All right.
Um, so I
Okay.
don't. Yeah.
Have you expressed to him like that you are still having like heightened anxiety, and that you've been feeling that you've been having to take more than you should?
No, if you could kind of help me to have that conversation with him,
Sure.
um, I'd very much appreciate it.
Yeah, that's something I can definitely do. I have seen providers in the past discontinue prescription medication if it's being abused, but that's again it really depends on the provider themselves. Um, but it's certainly a conversation that we can all have together and kind of discuss some techniques, and we can let them know that you and I are working together on some effective coping mechanisms to kind of handle your anxiety in addition to the Xanax.
Okay.
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 How does
Okay.
that sound?
That sounds good.
Okay. Would you would you be willing to create kind of like a log of, when you feel like when you have to take your medicine, and like what times those are, and if there's any stressful circumstances, or additional stressful circumstances?
Yeah.
Okay.
Um, I think there's like an app that you can kind of track that stuff with. Like,
Certainly, yeah.
could I use that and maybe share that with you?
Yeah, that would be awesome.
Okay. Okay.
Okay.
I can try to do that.
Okay. So I'll just have you sign the release for me to communicate with your doctor, if that would
Okay.
be okay. Um, and then maybe next time we can schedule a meeting, while we're in session, for us to kind of consult with your doctor and
Okay.
have those conversations, if that's something you're still willing to do.
Yeah.
Okay.
Okay.
All right. So thank you for coming in today. It was really nice to see you.
Thank you. See you.
Thanks. Bye bye.